Guys, today I'm going to talk about something that I say a lot in the office. But then I realized that it's what makes it easier to understand orthopedic infection, which is that orthopedic infection is very similar to cancer treatment. My name is Mário Soares. I'm an orthopedic surgeon and I dedicate my life to treating cases of orthopedic infection. In the office, I always tell patients this analogy so that they understand it very clearly. When we have a case of orthopedic infection, the treatment is the same as for cancer. What do you mean, Dr. Mario? Have you ever seen that story where you have to take it out with a margin? It's the same thing. If I don't remove the infection with a sufficient margin, the infection will come back. There's nowhere for it to go. There's no point in me taking out just a little piece. We know this very well in relation to cancer. Most people can easily understand this, so the reasoning is the same. Do you want to see something else that's very similar? It's the previous diagnosis. How do you know if the person has cancer or not? You do a biopsy. In the case of infection, it's the same thing, except that we have to do a culture. So sometimes we take a small piece, make a puncture, take the liquid, send it to the laboratory, it's infected, and it's with this bacterium. So it's very similar. Another thing that's extremely similar is the post-operative period. There are many cancers that you have removed and then you go for chemotherapy. They take a drug to kill those cells that are left in the bloodstream. In the case of infection, it's the same thing. We do the surgery and then do a cycle of antibiotics precisely to kill those bacteria that are left running around. And you're going to say, Mario, did you invent this? No. There's a doctor, he's already deceased in the United States, who was a student of another orthopedic surgeon who treated orthopedic oncology, orthopedic cancers. He went there, spent some time studying with him, and then, when he returned to his city, he dedicated himself to treating orthopedic infections, as I do, and he made this parallel. He saw that these patients were very similar and the approaches were very similar. He even outlined his treatment method in an extremely similar way and created a classification that is the same as the classification given to cancer patients, which is what we've already talked about here, the issue of type A patients, patients who are healthy and have an infection. Type B patients are those who have some systemic disease that hinders their treatment. And type C patients are those who can't be operated on, they can't withstand the treatment, so we go down another path. So I always talk about this in the office, and there's already a video here on the channel, but we decided to re-record it because this topic is very easy to understand. When I talk about it in the office, people understand and then they know why they have to do a very detailed debridement, and it also helps them to understand something else, which is that we know that there are those oncology surgeons who undergo specific training to do this type of surgery. In orthopedics, it's the same. What I do has had specific training to do it, which is why the result is different from those people who haven't had, the other surgeons who haven't had a specific focus on this type of situation. It's the same as taking someone who operates on something else and saying, now you're going to have to remove a cancer, something complex, it's not going to work. So the parallel, the analogy, is extremely similar, okay? I'd like to thank you once again. The channel is only growing. We're getting more and more feedback from patients, the importance of this information for our patients. So thank you once again, send a hug, and if you haven't subscribed yet, subscribe, and down here I'll put our ways of communicating, okay? So get in touch, especially via WhatsApp, and the secretary will be happy to explain how it works to talk to me. Cheers.